As we head into another summer with COVID-19 still circulating, tonight we're checking in on where things stand with the virus in Canada and what you need to know ahead of the fall. So here's a look at the situation in Canadian hospitals. After hitting an all-time high in January, the patient population with COVID-19 has fallen. Overall, a pretty positive sign. But with new variants spreading, how vigilant do we need to continue to be? For more on that, let's bring in Dr. Bogoch, who joins me tonight from Singapore. And Dr. Bogoch, you took some time from some health conferences there to speak with us despite your busy schedule, so thank you for that. Tell me, how would you describe where we're at with COVID in Canada today?
Currently, if we take a snapshot of where we're at today, we're actually doing fairly well. And certainly, as you just pointed out, the hospitals have significantly decompressed and the ICUs as well. So from a health system capacity standpoint, COVID, of course, while still here, is not flooding our healthcare system. And in fact, you've seen the hospitals really empty from COVID. Having said that, we are probably going to have a summer bump in cases. To the extent it translates into hospitalizations is not yet clear, but we do have some variants of concern that are circulating in Canada that are sadly more transmissible, and that will very likely cause a rise in cases. And whenever we see a rise in cases, of course, we are dissociating cases from hospitalization with our buildup of immunity in the community, but it still will probably translate into some people sadly becoming sick and landing in hospital as well.
Right, because, I know plenty of people who feel like the pandemic is sort of over, right? Like even on the subway, I take it every day, maybe half of people don't mask. Is that pretty reasonable or is that premature?
We're in a state now where most of the mandates have been lifted and people can take whatever protections they feel necessary. They can wear a mask or they don't have to wear a mask. I just think it's important to remind people that, yes, while there's probably less COVID circulating now than there was 1 month and 2 months ago, it isn't gone. It's still here. And in fact, if you look at wastewater surveillance across the country, you're seeing an uptick in cases or an uptick in the community burden of COVID through the wastewater surveillance system in many different parts of the country. So, of course, it's lower now than it was before. Having said that, it certainly isn't gone.
What about reinfection? Because, I also know people who've gotten sick and who, I don't know, almost think of it like, whew, that's done with. I don't have to worry so much about it, at least for a little while.
Now, unfortunately, with the variant that's becoming increasingly common, this is the BA.5 variant. That's probably about 20% of all COVID right now in Canada. It can cause reinfection. Now, of course, we don't want anyone to get infected, but having said that, people who've been vaccinated or who have recovered from prior infection are just less likely to have a more severe illness, but certainly you can get reinfected with this.
You mentioned vaccinations. What about a fourth booster or any booster, depending on how many anyone has gotten at this point? Right.
At the beginning, it was very easy to say, everyone should get this vaccine, get vaccinated. Now it's becoming increasingly complicated. There's certainly people that would benefit from booster vaccines. It's obvious. Older individuals, people with underlying medical comorbidities certainly should be up to date on their vaccines, including that booster. And there's good data demonstrating a decrease in significant illness. But remember, the vaccines don't do as much as they used to in terms of protecting us from infection. They really protect us from severe infection, hospitalization, and death. So if we're looking at younger cohorts or other cohorts that are at less risk of severe infection who have already been vaccinated, it's not entirely clear what, for example, a fourth dose would do and if that would provide meaningful protection against more severe illness versus 3 doses in that cohort. So I think we need to study that a little bit further.
I've got 20 seconds left. You mentioned a spike during the summer. How worried are you about a backslide to the dark days, either in the summer, the fall, or even the winter?
That we have to communicate uncertainty. Things are going well now. Things appear to be going okay, even with the rise in cases, but we still have to be careful. I don't think this is over yet.
Dr. Bogoch, thanks for making the time.
My pleasure.